So we are once again joined live with Dr. Dana Hawkinson from the University of Kansas Health System. Doctor, good morning. Thanks for joining us. Let's start with the fireworks shows. A lot of shows have been canceled, but for anybody who is putting on their own, what precautions should you be facing this 4th of July with those?
Yeah, I think those are precautions you need to take whenever you're using fire and explosive things. Certainly be careful. You know, luckily we've had some rain, so we always want to make sure there's no fire danger. In addition, you know, use the fireworks as directed. Don't shoot them at other people. Most of the time, it's just going to be putting them on the street or the area where you are and then lighting it off. Again, use extreme caution. We had one of our surgeons on who is a burn surgeon, and he sees these very horrific injuries every year, all year. So it's very important to, again, use the fireworks as directed, use extreme caution. And if you can just do that and continue to be safe, you know, have everybody stand back so nobody gets any collateral damage, that's probably the best information and message we can give.
Doctor, the 4th of July is one of those holidays where we like to have lots of people over. Let's all gather in the backyard, let's cook something, let's hang out. What would be your recommendation about that? If it's okay to have family, if it's okay to have close friends, what's the recommendation on do's and don'ts for this weekend when inviting people to your home?
Yeah, I think you're exactly right. You know, as we have reopened, more and more people want to get together with friends, family, loved ones. I think that can be done. We have to talk about who is in your bubble. We've talked about who is in your bubble, who have you been associating with, and understand who is in their bubble. Certainly family tends to be probably less risky, as you can have those types of conversations with your loved ones, and maybe especially the older or vulnerable populations are not going to be out and increasing their bubble. That could be safe. Certainly we would prefer outdoors. You know, there is very good evidence to suggest the close proximity indoors is much more risky than doing things outdoors. Certainly smaller groups if possible. If you do have people over, have them bring their own food. Have no communal food. You can spread through that if people are picking up utensils and dropping food onto their plate and things of that nature. So, you know, less people outdoors, spread apart. If you can continue to maintain those things we've talked about, that's going to be the most important thing as we go in and people are gathering.
Doctor, we want to switch gears here to masks, especially now that we are seeing more and more mask mandates in our area and a lot of people wearing them in public. We've seen some fears that you could get sick potentially from wearing masks, even talk about carbon dioxide when you're wearing that mask and breathing it in. Can you just break down some of those for us?
Yeah, absolutely. So we do know and understand that masks can cause some not harmful effects, but really nuisance effects. So these include mostly skin irritation or lesions or wounds on the bridge of your nose. You know, I have colleagues and nurses here who have to wear N95s all day long for their shift. They would prefer not to wear the N95 mask because it is rough on the bridge of their nose. But however, besides those skin effects, really the other effects are really not true. We have surgeons who do critical surgeries for hours on end with N95 masks on. They are able to function. You know, the typical cotton mask or even the surgical mask offers enough gas exchange, so you're getting enough oxygen in, and carbon dioxide is able to filter out just fine, so you're not going to really suffer any effects from that. And again, we're talking about the people who don't have the severe medical problems like the severe lung disease who can tolerate the mask. So really, besides skin irritations, which have been well recorded and published in journals, the gas exchange issue is not really a significant issue. It's not important. It is not true. There is plenty of gas exchange doing that. The other myths were that you are breathing in more bacteria and more virus. That is not true either. Again, we have surgeons who are doing critical surgery on you and loved ones every day who have masks on for hours at a time, and they do fine. So certainly moving forward, wearing a mask for 10 or 20 minutes while in a grocery store or running an errand is not going to cause any harm.
And we've talked about tips to fight some of the skin irritation, too, that you're referencing there, too. Dr. Hawkinson, as always, we appreciate your time. Thank you very much, and happy 4th to you.